welcome to our Foundation Arcp webinar. My name's Mike Masding. I'm co-chair of the UKFPO and lead Foundation School Director in England for HEE, and I'm joined by three colleagues this evening: Dr. Clare van Hamel, Foundation School Director in the Severn Foundation School, Dr. Fiona Cameron, Foundation School Director in the Scotland Deanery, and Dr. Wassim Merzougui, who's one of our excellent UKFPO Leadership Fellows and is a Foundation Year 2 Doctor. We'd like to really thank those of you who've submitted questions in advance of the webinar, and we'll be answering as many of those as we can, both as part of the presentation and afterwards as well. Just a little bit of housekeeping. This webinar is very much about Arcps, and we can only answer questions on that particular topic and on recovery from COVID during this webinar. But if other topics are of great interest and that you'd be keen to have a webinar on, then please let the UKFPO know. It's being broadcast to many people. We're hoping to have a big audience, and already I'm pleased to see we've got over 100 people. So I'm afraid we can't answer questions on individual circumstances or very personal issues, but we'll try and keep our answers as broad as we possibly can. If you do have a significant problem, then please talk to either your educational supervisor, your foundation programme director, or the head of the foundation school. The webinar will be recorded for those who are unable to join live. So if you know of anyone who can't make it tonight, they can keep an eye out on our social media channels over the coming days for the recording. Throughout the webinar, as you can see on this slide, there is the opportunity to ask further questions through the slido.com website. And if you go to that website and input the code shown, #Foundation ARCP, all one word, then you will be able to submit questions, and we'll do our best to answer those. We know there's probably going to be a lot of questions tonight, but we hope we can answer most of them, and particularly the very important ones. But we're going to limit this webinar to about an hour and 15 minutes, so we hope to finish at about 8:15. If we don't get all the questions done, we will try and answer them on our website in a frequently asked questions type way. So please keep asking the questions, and the panel will do our best to answer them. Next slide, please. Next slide, please. So first of all, I'm just going to talk about the general principles of Arcps, as I know there'll be a lot of trainees who won't have been through one before, particularly if you're in the F1 year, and even those of you who are as an F2 will have only been through this once, in all likelihood. So just to say what the function of Arcps is, because it's often misunderstood as to what these are for. It stands for annual review of competency progression. So as the ACE that suggests, it's something that's done once a year, and for the vast majority of our foundation trainees, the once a year is at the end of the academic year, somewhere end of May, early June, in order to get all the paperwork done so that you can get full registration as an F1, or go through and complete the foundation programme if you're an F2. I appreciate a lot of trainees will be out of sync for a whole variety of reasons, which is still absolutely fine, and you'll still get an Arcp towards the end of your training year on a pro rata basis. So if you're working, for instance, 60% of the time as a less than full-time trainee, you will have your Arcp somewhere around December, January, so that you can complete your foundation year. The two main functions of Arcp: firstly, progression assessment. So it assesses how well someone has progressed it over a defined review period, which is quite simple in F1 and F2 because it's a year. It will review lots of evidence from lots of different sources that will be in the portfolio, and will be done by a panel of people, as some of my colleagues will explain later, to make a global judgment on progress. So it is a summative form of assessment, which really establishes whether the trainee has the required capability to get full registration for F1 or complete the foundation programme in F2. It also has a very important function for you as doctors so that you can revalidate. The GMC requires all doctors from F1 up to even an old looking consultant like me to revalidate on a regular basis. And the ARCP is recognised by the GMC as being equivalent to a consultant appraisal and appraisal for a senior doctor of your full scope of practice so that you can revalidate. So it's really very important that you have an ARCP. The processes are all in place to ensure that happens, not just so that we can assess your progress, but also to fulfil the GMC requirements for revalidation. Next slide, please. So what the panel does, it reviews all the evidence that's available, usually in the e-portfolio, and as it says there, makes a judgment of progress against the required curriculum. And Clare and Hamel will fill you in greater detail about what that curriculum is all about. It'll make a recommendation on an appropriate ARCP outcome, having made a summative assessment of progress. And as we've said there, it does review revalidation requirements. So in England, a Form R, in Scotland, a SOAR form, and other forms in Northern Ireland and Wales, and flags any concerns to your responsible officer, who is the postgraduate dean in the area that you work. These are the ARCP outcomes that are available, and it's really very important to try and understand what these mean. So an outcome 1 or 6 is satisfactory. That's what it says. It says it's satisfactory. It doesn't demit. There's no grades of it, so it doesn't demit excellent. It just says that you've reached the required standard as judged by your supervisor and then the ARCP panel to progress. So outcomes 1 at the end of F1 and outcome 6 at the end of F2, because an outcome 6 means you've completed a programme. So, for instance, specialty trainees in a specialty like anaesthetics, when they complete their anaesthetics training, will get an outcome 6. We use outcome 6 at the end of F2 because that is the completion of the foundation programme. So if you're an F1, you should be wanting to achieve an outcome 1. If you're an F2, you should be wanting to achieve an outcome 6. These are outcomes that allow you to progress. Outcomes 3 and 10.2 mean that you will have to spend more time in training with an extension, which is there to try and help you develop so that you get to the standard required to achieve all that we need to do to complete that particular year of the foundation programme. So it means that you will be given very specific targets and a specific time frame in which to achieve these, and it will all be explained to you after you've had the ARCP. The difference between outcome 3 and 10.2 is outcome 3 is where it's felt there are some concerns about performance which can be ameliorated with appropriate development and supervision. Outcome 10.2 is a no fault outcome, so it doesn't suggest that there's any problem with the performance, but there's been sufficient time or lack of experience due to the COVID pandemic. So if you're awarded an outcome 3 or an outcome 10.2, it means that you will have to spend more time in that training year. There'll be an extension to it, but you will be given very specific outcomes that you will need to achieve in that time. I hope you won't get an outcome 4, which is unsatisfactory progress, and where the trainee will be released from the programme. And outcome 5 is what we call administrative outcome. This simply means that the record that you have kept as a trainee in your e-portfolio is incomplete. So it really doesn't mean any decision has been made at all. It simply means that the panel would like you to complete the requirements in your e-portfolio. So, for instance, if you've got a supervised learning event missing, if you have not completed all the requisite forms, including Form R, you may well be given an outcome 5. You will generally be given 2 to 3 weeks in order to get everything in place, and then you'll have another ARCP where you will be given an outcome. So if you get an outcome 5, please don't worry. Please don't sit there and think that you've in any way failed or not reached the standard. It really just means nothing. It just means that you've been given a little bit more time to get everything done. We'd prefer you not to do that because it means that we can award an outcome 1 or a 6 much quicker. But if you get an outcome 5, it just means you get an extra couple of weeks to get everything into your portfolio and sort it out. This is what the Arcp doesn't do. It doesn't provide any formative feedback. In other words, you should have been receiving feedback on your performance from a whole myriad of different people, all the people who've been supervising you, clinical supervisors, educational supervisors, the doctors and nurses that you work with, the other allied healthcare professionals, of course, that you work with. And they should have been providing feedback that's formative, that helps you develop throughout the year. The Arcp is a summative assessment that just comes up with a decision as to whether you've made the right progress. It can't make recommendations on educational support and how that might be delivered. It will give a list of things that if you're given a 3 or a 10.2 or indeed a 5, you will be given a list of things that you need to do, but the Arcp panel will not advise about how those are to be achieved. That's to be advised by the educational supervisor and your foundation programme director. It's certainly not a rite of passage. The reason we put this webinar on is that we know it's something that may be alien to you, but we do want you to take it seriously. We do want you to put all your efforts or as much effort as you can into preparing for your Arcp, and Fiona and Wassim will talk a little bit later about what you can do to ensure that you get an outcome 1 or a 6. And Arcps are done remotely by a panel meeting together, often virtually, and so there's no coaching or mentoring role. Often, in fact, usually, you will not have any discussion with the panel at all until you've been awarded an Arcp outcome, because it's done virtually and you won't be there. So there's no coaching or mentoring role. It is purely a panel to assess your progress. So I'm now going to hand over to Clare, who's going to put a little bit more detail onto those bones about about what the requirements are for Arcp in the summer of 2021. Thanks, Clare.
Hi everybody. So I'm going to go through the derogated foundation programme Arcp requirements. First of all, I'm going to go through the parts that haven't been changed. So next slide, please. Next slide, please. Thank you. So one thing that's obviously very important is that you are still going to have to demonstrate that you're a competent and safe practitioner. What we're doing in the foundation programme is training people to be safe doctors, and that requirement hasn't gone just because of COVID. Also, something that hasn't changed is that we still require you to complete a year of training, and that's a year of full-time equivalent training for those of you who are training less than full-time. The GMC has decided that in terms of time off that would be allowed, you can have 20 working days off as a agreed amount that would be seen as reasonable. Any time off beyond that, and still aiming to get a Arcp outcome 1 or 6 would be at the discretion of the postgraduate dean or their delegated representative, which is often the head of the foundation school. And as I say, to note that's working days off rather than actual days off. We still need you to demonstrate that you've achieved all the curriculum foundation professional capabilities, and also that these have been signed off as satisfactory by the educational supervisor. So those are unchanged requirements. And moving on to the next slide. Next slide, please. will still require you to have satisfactory clinical supervisor reports. These are really important, actually. Your clinical supervisor and your educational supervisor are going to be the people who know you best and are best able to really decide whether you're ready to move on to the next stage. And one of the things that I think people get very het up about is having to extend their programs. In reality, what we want to make sure is that when you do move on to the next stage, you're ready for it. Moving on before you're ready just means that you're going to then find it more challenging to meet the next year's expectations. So we do require you to have satisfactory clinical supervisor reports. You can have one unsatisfactory report, but it can't be the last one. And if you do have a unsatisfactory report in the, say, first placement, we'd anticipate that you'd be showing that you are making some progress in the subsequent placements, and that's reflected in the supervisor reports. Similarly for the educational supervisor report, so the final supervisor report, educational supervisor report, which is called the end of year review, has to be satisfactory in order for you to get either an outcome 1 or an outcome 6. You also have to have at least one satisfactory tab round with the correct number and mix of assessors. The placement supervision group isn't actually mandated, although it is strongly recommended and will actually be mandatory in the curriculum from 2021 onwards. So from August next year, you will be required to have a placement supervision group that is said to be satisfactory. Can you go to the next slide, please? So a few other things that aren't changed is that we still need you to demonstrate the equivalent of ILS competence. You also need to, for this year, have the core procedures completed, and this is for F1, and also have to have completed the prescribing skills assessment certificate. So, and that has to have been within the last 2 years. For F2s, you need to have had the equivalent or an actual ALS certificate to demonstrate that you have the skills to look after the critically ill patients. And then next slide, please. And here we begin to think about what the derogations are. So quality improvement, we still want you to understand quality improvement, and ideally it would be nice if you have participated in a quality improvement project, but we understand that COVID has got in the way of quite a lot of things this year, and so we've agreed that there would be a derogation such that you can demonstrate evidence of understanding quality improvement rather than necessarily participating or presenting a quality improvement project. Some of the ways of perhaps demonstrating this is by completing the e-learning for healthcare quality improvement modules, which should be accessible for all trainees regardless of where they're training. Next slide, please. So other derogations are on the SLEs, or supervised learning events. So we've reduced the number of supervised learning events that you need to achieve. So the mini KECs and the DOPs, you need to have at least 6 observations of your practice, and at least 4 of those must be mini KECs. And the CBDs, we need you to do a minimum of 4 per year of training, and that's full-time equivalent training. We've taken out the developing the clinical teacher as a requirement for this year. A further derogation is that we normally require you to attend 60 hours of teaching. This year we've reduced that to 45 hours overall, and normally we ask you to differentiate between that teaching which is said to be core, i.e. only really put on for foundation trainees, and non-core, which can incorporate quite a sort of wide variety of opportunities. So for this year it is 45 hours overall, and you don't have to differentiate between core and non-core teaching. Next slide, please. And if you manage to do that, and hopefully most of you will find that deliverable, you'll get to the finish line and you'll be awarded your certificate of either completing an F1 training programme or an F2 training programme. I've got a couple of questions that were already posted to us in advance, so I'm just going to read out the question and then give you an answer before I hand over to Fiona. So the first question is that I understand that foundation years are time served. I had to start my FY1 6 weeks late due to COVID related issues. Is there a case by case panel discussion for these cases, or would I have to serve the extra 6 weeks? So this is an important question. This comes into the sort of area where it would be up to the postgraduate dean or their delegated representative to consider your progress during the year. Having started late, it may well be that you didn't achieve a sort of necessarily satisfactory progress in your first placement. So it may be that you have then caught up and are demonstrating adequate progress, or even more than adequate progress. If the foundation school director who's representing the postgraduate dean or the postgraduate dean considers that your progress is satisfactory despite having more than 20 days of working days off, then it may be possible for you not to need to extend, but that is a decision taken by the postgraduate dean or their representative. We can't give you a blanket response to that question. And the next question that was posted was if a concern has been raised in the PSG by one consultant but not by other consultants, will this affect the Arcp outcome? Now, if a concern has been posted, it would be useful to consider the concern and whether it's have a significant concern about your performance. So if someone has posted something that indicates that actually you're a seriously dangerous doctor, then obviously that may have an impact in terms of whether you should be progressing. If it's something that is a relatively minor concern and there's been a discussion, reflection, learning from that concern, then it probably won't impact on your progress. So it's only likely to impact on progress if it's a serious concern that has not been resolved. I'm going to pass over to Fiona now, who's going to tell you about the sort of the details of what's required for Arcp.
Thank you, Claire. Yes, I'm going to talk in a little bit more detail about the actual process of the ARCP. I'm making no apologies for talking a little bit again about the rationale for the ARCP and talk about what you must do, what will happen. I'm trying to demystify it a little bit. So next slide, please. Thank you. I'm also going to talk a little bit about what you must do to get through your ARCP and when you must start doing that, i.e. now. And I'm going to talk about the implications of the Arcp and what happens if you don't have a satisfactory outcome. Next slide, please. Okay, thank you. So as we've already heard, it stands for the annual review of competency progression, and it's absolutely required for the progress from one training year to the next. And it happens annually. So if you are less than full time, if you're out of sync, if you've been off for a period of time, whether that be due to health or maternity or whatever, you still have to have that annual review. So once per year, you will have this annual review. You may not be awarded an outcome that allows you to progress into the next training year annually, particularly say if you're working at 60% or 50% or 80%, you may need to get a little bit longer because you're working less than full time, but you will still have to have that review annually, and an appropriate code to reflect the fact that you haven't completed that training year will be put into your portfolio. Now, time-wise, usually the ARCP happens in June, and that is because you need to have everything processed and ready for the next training year, which is normally August. And if you're leaving foundation, then to take on your next post, whether that be a training post in a specialty or general practice, or whether it is in a clinical fellow job, these jobs normally start in August. So we need to have you ready to start your next job in August. If you're an F1, you have to get full GMC registration, and we really need to have your Arcp done relatively early in June. Because if the Arcp is not done in June, then the GMC don't have enough time to process the application to give you full GMC registration in time for you to start F2. This is a very frustrating thing, because when you start your final post in April, you really don't have very long to get all your information into your portfolio before your ARCP happens. So it's a frustrating time, and people always ask, can it not be a bit later? Can't we? But the answer is, we need to give the GMC time to process all 7,500 of you, to give them GMC numbers. So that's the rationale for it done at that period of time. It is a formal process, and as Mike already has defined the outcomes. It's a desktop exercise. You won't be invited to be there. It'll happen in your absence. You won't know it's going on. You'll not see anything inside your portfolio. If you open your portfolio, you won't say, oh, my ARCP is happening just now. You won't be aware of anything that's going on, other than the fact that you're a senior administrator will have contacted you and given you the date for your ARCP, but you won't be aware of what's happening during the process. There is no requirement, in fact, you will not be invited to attend your ARCP unless you are going to get an outcome that is not a standard outcome, and that will be given to you verbally. But again, that process will be explained to you if you're not expected to achieve a satisfactory outcome. The senior educators that are working in your deanery and your foundation school will be your panel members, and there will be a panel of 3 of those senior educators, and they will review your portfolio process, review what's in there, and they will map them to the ARCP outcomes, and based on that they will give you an ARCP outcome. If the information is not in your portfolio, then they can't give you an outcome. So they may know you, they may know who you are, and they may say, oh, you know, even if they know that you may have done that, if it's not in your portfolio, then they cannot give you an appropriate, the required outcome. So it's really important that that information is put into your portfolio. If you don't agree with the ARCP outcome, then there is a formal appeals process. You will be given information. If you don't achieve a satisfactory outcome, you will be given information of how you can appeal. It's time limited. You can't decide 3 months later that you don't like your ARCP outcome. It's a very tight process, and that ARCP will be reviewed by a different panel, and there will be a foundation school director from a different foundation school. So it is possible to appeal if you don't agree with your outcome. But I have to say that the vast majority of ARCP outcomes, the appeals process doesn't succeed, and the ARCP outcomes are upheld. It is a very robust and fair process, and everybody who is doing ARCPs is trained. And it's a very transparent process. So please be assured of that. Thank you. Next slide, please. Okay, so we've talked about what the actual panel does. Let's think about what you should do. Now, if you haven't started to, you absolutely must get into your portfolio now. Review your portfolio and have a look. And Clare has explained the requirements. The requirements are all available on the UKFPO website for you to view. And make sure that what you have in your portfolio is what is on the UKFPO website, or exceeds that. Okay, so it's very important that you have that in. You'll be given a deadline to have that information in your portfolio. If you don't have everything in your portfolio by the deadline, then you may well receive an outcome 5. Sometimes it's hard to get things in your portfolio. Sometimes your supervisor might be slow in filling in your supervisor's report. They may be off sick, they may have been on call, but that's your responsibility. Your responsibility is to contact your supervisor well in advance of the time that you need to get information in your portfolio. It's not good enough to say, oh gosh, the deadline's tomorrow, I must contact my supervisor and ask to get signed off tonight. You've no idea, they may be on annual leave. They're not going to be away at the moment, obviously, but they may well be away. So it is your responsibility and not your supervisor's responsibility to make sure that's in place. Sometimes it's hard to get that information in your portfolio, so you will have an education supervisor, you'll have a foundation training program director, and they will be able to help you with that. But give them time to get that information in your portfolio, and this is absolutely your responsibility. Some trainees find it rather frustrating. They say, but I asked my supervisor and it wasn't signed off, or the tab wasn't completed, and it's not fair. I've now got an outcome 5. An outcome 5 is a holding number, and it just says things are not there, and you get that little bit of extra time. The time that you get is normally 2 working weeks. It's normally 10 days, but that can be adjusted by your ARCP panel, but that is the normal time frame. Once your information is in your portfolio, that outcome 5 will be converted to the most appropriate outcome, whether that be a 1, a 3, a 6, or a 10.2. So that outcome 5 is a holding email, a holding number that just gives you a little bit more time. Ideally, try and avoid it if possible. It's much more simple if you can actually get it in. Next slide, please. Thank you. Okay, so what happens? Tonight you go and start looking at your evidence, make sure it's in there. When you are asked to have your evidence in your portfolio, you should have everything neat and tidy in your portfolio with your evidence there. The ARCP panel will convene on the day that it was scheduled to convene. At the moment, most of these are virtual, and as you know, you can share portfolios, you can share screens, so all the panel will have access to view your portfolio and will review the information that has been presented in there. They then come to a decision as to whether you have met the required outcomes, and then you will get that outcome issued to you. That outcome will actually go into your portfolio, and you will get an email or contact to say that there is an ARCP outcome in your portfolio. You then have to go into your e-portfolio and acknowledge that outcome on your e-portfolio. And I have to say, I have to reassure you that the vast majority of trainees receive a satisfactory or a standard outcome, so that they are in the majority. So although this sounds quite frightening and quite scary, and have all that information in and these adverse outcomes, most people get through the ARCP without any problems at all. Next slide, please. Okay, so let's just say that if you don't receive a satisfactory outcome or a standard outcome, then you will be informed. Now, usually your supervisor will anticipate the fact that you don't have, you will require an extension to your training. And it's likely that you'll be informed in advance of the panel, but that is not always possible, and it may well be that when the panel convene, the agreement at the panel is that you need additional training. Now, if you require additional training, you will be requested to attend a face-to-face meeting, and at that stage, with your trainers, they will then make a decision as to what needs to be done, what extra training requirements you need, whether it's time, whether it's competencies, whether it's tabs, and that will be done by your trainers and not by the ARCP panel. The ARCP panel makes that recommendation that you need more, and the actual trainers make that decision as to what has to happen. It's often bespoke. It's not the same for every trainee, because obviously every trainee has different training requirements to get them to meet the ARCP standard. And as I've mentioned before, there is a formal appeal process, which if you feel that you need it, you can use, and it will involve an external review. Thank you. Next slide, please. Okay, so in summary, I think I could have filled several slides by saying prepare, 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 because the way to get through your ARCP is to have all the information neatly prepared in your e-portfolio in a structure that it is easy to understand by your supervisors, that the panel will be able to map your outcomes to the ARCP requirements, and see that everything is done. So start now. Don't be anxious. It's not a huge test, and if you've been working throughout the last training year and populating your portfolio, then you should have no problems. Be organised. Whatever you do, don't leave it to the last minute, because it will take you several hours to do this. You know, set aside a good few hours to get this in place. If you leave it to the last minute, you won't have time to get everything through, and be organised. And remember, a lot of what you need to have in your portfolio is not something that you can populate. So your tab, the PSG, if you're doing one, your supervisor's reports all require other people to complete things for you in your portfolio, and people have other commitments, they are busy, and they don't always they can't always return your requests turn it around within 24 hours. So give them time to do that, and contact them early. And if they don't respond to your contacts, contact them again politely, because they do have to do this. And you may need help from other people. So it's really important that you're organised, you're on time, and also your trainers, your colleagues, everybody expects to help you achieve your ARCP requirements and knows that you need things for your ARCP. So don't be shy, and do ask. Okay. Thank you very much. Next slide, please. Okay, I'm going to, before I hand on to Wassim, I have a few questions that were submitted in advance, and I'm just going to read them out and then answer them. Okay, so the first question I have is, for curriculum linking, do we need to provide evidence for each descriptor? For instance, an FPC with 4 descriptors, does that automatically mean there should be 4 pieces of evidence there? Okay, so what we're talking about here is the foundation programme professional capabilities, and underneath each of these there are a list of descriptors. These descriptors are suggestions of things that you might want to use to evidence the foundation professional capability. The answer is no. You need to link to the FPCs. Now in the Horace e-portfolio, you link to the FPCs, and you need a minimum of 1 and a maximum of 5 links. In Scotland and the TURAS e-portfolio, the actual linkage is directly to the descriptors. So some of the descriptors are up to 9. Some of these FPCs have 9 descriptors. So no, you don't need to link to each descriptor, and you may have some blank. It's important that you evidence the FPCs and not the actual descriptors. Next question I have is, when will the ARCP be for a 60% less than full-time trainee? Can less than full-time trainees be assessed at the same time as full-time trainees so they can at least get their competencies signed off? So this is an important question, and the answer is that all trainees, whether you are full-time or less than full-time, need an ARCP every year, and that is annual and not every training year. So if you are less than full-time and working, say 60%, 80%, whatever, when it comes to the June ARCP, you will still have an ARCP. The panel will look at your progress, but you won't be given any of these outcomes. You'll be given an N code, and there are a variety of N codes which reflect the fact that you are not ready to actually complete that training year. But there will be something within your portfolio that says that your evidence has been looked at to acknowledge that you are training. So the decision about being signed off is at the discretion of the ARCP panel, but it is likely that you'll need the full training year, which will be longer than 12 months, 12 calendar months. Okay, thank you. I have one further question. Can more SLEs in one rotation replace SLEs in another question? Sorry, in another rotation. What we would prefer is for you to show learning in each of the rotations. So what we don't want you to do is do all 10 SLEs in post 1 and then do nothing for the rest of the training year. We want to see you learning in each post, because each post that you do will have different learning opportunities, and we want to see a range of learning for all the curriculum outcomes. So we want to see them spread out, but we would maybe accept if there was one less in one rotation, one or two less in one rotation, to be compensated with another, but in another rotation. But certainly what we don't want to see is you batching them all in one rotation. That would not be satisfactory for the ARC panel. Okay. But ultimately it is up to the ARC panel, but best practice would be that you do spread them across the year. Okay, thank you. I think there's one more question. I think Claire was going to take that question, is that right? There's a question. Will I read it out? Or you want to read it out, Claire?
I'll read it out.
Thank you.
So there was a question asked about whether you had to provide a minimum number for each FPC in terms of evidence, and yes, you do need to have a minimum number. That minimum is 1. The important thing in terms of the evidence that you supply as to whether you've met the curriculum outcome is whether the quality of the evidence is good. So it's often better to have 1 good piece of evidence rather than 5 not really very good pieces of evidence. So if you have a think about what you've added as evidence and think of it from an external point of view, think, have I really demonstrated that I've met this FPC? Will the panel be thinking, oh yes, that's clear that they've demonstrated competence in that particular area of the curriculum when you're reviewing your own portfolio before the Arcp. Right, I'm going to hand over now to Wassim, and thank you very much indeed, Wassim, for joining us to give us top tips in terms of the trainee view of achieving a successful Arcp outcome.
Hello, my name is Wassim and I'm currently one of the UKFPO Leadership Fellows, and I'm a Foundation Year 2 trainee based in the East Midlands. And today I'm just going to give you a few hints and tips for ARCP this year. A lot of them are based on my own experience, but hopefully you'll find my advice and hints useful to your experience as well as a Foundation Doctor. Next slide. So the first thing I want to talk about is this formula where people think that minimum effort somehow equates to maximum reward, which is so not true. I remember when I was a Foundation Year 1 trainee, speaking to some of the F2s, you know, they used to try and like almost instill into me this hustle mentality. You've got to hustle your way through foundation training, which I learned the hard way isn't the way you're supposed to do it. As you can understand, I'm sure they try to give me their advice from a good place, but what we know is that sometimes advice from a good place isn't necessarily the best advice to take. So my advice to you, a more strategic form of advice, is to do more in your portfolio. Doing more is safer for you and safer for the patient. Next slide. So the first thing I want to talk about is starting early. Starting early gives you the best chance to get comfortable with your portfolio, and also there's a new curriculum which will be released this year. It will stand you in good stead to review the new curriculum, so you can see the new outcomes and also set yourself some targets on what you want to achieve throughout the year as well. Create or request an ARCP checklist. Again, I don't like the ARCP to be referred to as almost like a checklist or some form of criteria. What I suggest is perhaps you speak to your FTPD or your trust and ask them for a checklist just to give you a sense of direction on what you need to complete throughout that year. But remember, your foundation training encapsulates so much more than just a checklist. So yes, just use one just to give you a sense of direction on what you want to achieve in that year. So spend time looking through your portfolio with by yourself or an F2. I think that's one of the things that I did when I first started. I remember on my lunch break, I sat with one of my F2s and she just showed me on her phone how to navigate through the whole risk portfolio. I know there's TRS as well. And it literally took 15-20 minutes. And I thought, you know, it was quite easy to navigate through, and it was just a nice refresher. And it made things seem a lot easier than what I expected it initially to be. So I definitely would recommend you do that at the beginning. So next point, notify the clinician you'll be working with that you want to complete a CBD mini-KEC stops. Again, one of the things that I did when I first started is I would tell the registrar or the consultant before ward round that I would like to complete one of these mini-KECs CBDs, and then hopefully would do the ward round, and then they would pick what they believe to be an appropriate patient for me to assess me on. And that way I always noticed, in terms of saving time, that, you know, by giving them time to find a patient for me, that most likely in the day I would be assessed. Whereas if you come out of nowhere and ask them, hey, you know, in the middle of the ward round towards the end of the day, I'd like to do mini-KEC CBD, most likely going to say to you, oh, let's do it another time at the end of the week. Or in some cases, if they tell you next week, then it's safe to say that you probably never see that clinician again. Again, I'm speaking from my own experience. Next slide. So some competencies are easier to attain in certain specialties, definitely. For example, administering local anaesthetic. Most appropriate specialties you'd be expected to complete this is probably in general surgery or in trauma and orthopedics or even A&E. Would you be expected to do that in a medical job? It's not easy unless you have a patient on the middle of a night shift who rolls over and, you know, sustains a laceration. Most likely in that situation, what you'll do is probably just call the surgical SHO, because some say that medical nights are slightly busier than surgical nights. Again, that's, you know, that's a topic of debate. We'll discuss it another time. Nurses can sign you off for competencies, yes, if they're banned. I believe it's 5 and above for certain competencies. For example, administering and preparing IV medications. Again, they do this day in, day out. They will be happy most of the time to give you that teaching, and, you know, it's a different type of feedback as well. And also there's this belief that doctors can only sign doctors off. This isn't true. Try and ask nurses as well, and, you know, it's something which I did, and it saved me a lot of time in the long run as well. And I also asked for a cheeky tab after it as well, if that's something you want to consider down the line. So use your on-calls to complete mini-KEC stops CBDs. Yes, so I personally found my on-calls the time where I completed a lot of my portfolio, especially when I was based on admission units. And if you think about it, you're seeing an influx of patients with so many different presentations. So obviously, to try and capitalize on that, what I used to do is I used to speak to the registrar before my shift. Again, just give them a heads up. I'd like to complete this throughout the day. They would usually suggest, or you should suggest, perhaps just before handover, we can do a quick mini-KECs or a CBD. Because if you think about it, in the last hour before handover, usually you're just tying up your jobs, and obviously the registrar who's coming off on call is getting ready for handover, and usually you can find a good 15-20 minutes to complete a CBD or a DOPS or a mini-KECs. So next point. So for developing the clinical teacher, don't wait for teaching opportunities, create them. So yes, use your own initiative. So, for example, there will be some of your colleagues who will be organising, let's say, teaching within the trust or regional teaching or even national teaching. My advice to you is to ask them if you can participate, whether it's being involved in creating these teaching sessions or in actually hosting them as well and teaching within them. I think it's something that you have to use your own initiative for. One thing that I used to do as well is that we used to have weekly departmental teaching, and I used to just volunteer if I could teach or if I could highlight an interesting case I came across during, you know, one of my shifts. I used to give a 15-20 minute presentation, and again, that classes as a form of teaching as well. So next point. Make use of additional achievements and upload them. Yes, upload them onto the portfolio. Why I say this is because it makes things so much easier when you apply for specialty training. All of your certificates, all of your reflections, everything's kept in one place. So when you do apply for specialty training, you won't be having to faff around trying to find where things are. You'll already have it in one place. And also when you download things off Horace Portfolio and Juris, they look a lot nicer, a lot more professional as well. Just in case you wanted to use it in other applications, you know, outside of medicine, for example. So I would recommend using the portfolio as your hub to collect all your achievements and your skills and competencies. So for clinical leadership, aim to lead board round. Yes, that's one thing that I did. So there is a section in the portfolio where you are encouraged to demonstrate some form of leadership. One of the things that I used to do was just before ward round and board round, I used to go through all the patients and explain to the team who the patients were and what their current management plan was. That was, seen as an opportunity where you're being a leader. I used to get that signed off. Also, for example, when I was on my trauma and orthopedics job, when a patient was first admitted, I used to volunteer to do the primary survey under the supervision of the A&E consultant. And again, if he was happy, he would, have a discussion with me and sign me off for that as well. So again, the idea of leadership isn't exclusive to various activities within your foundation training. It's an opportunity for you to show where you have actually demonstrated that you've taken the initiative to try and lead a certain situation. Next slide. So yes, reflections, reflect. Not only is it a good way, is it a good practice of, trying to engage with your learning throughout your foundation training, but, I think there's also this misbelief that you should only reflect when something bad has happened, which isn't the case at all. You should also reflect when, you've had a good event or, you've demonstrated, certain skills. Reason being this is when it comes to curriculum mapping, one of the ways I used my reflections was, for example, there's a section on, dealing or managing an end-of-life care patient. And when I was on my oncology job, obviously this used to happen quite regularly. What I would then do is reflect on the good management, and then I would then map it to that section in the curriculum to show that I have been engaging with the portfolio as well. And that's also a useful way of using your reflections. So I definitely urge you to do that. Next point, make sure to map your content so that your supervisor can log your engagement. Now, this is one of the issues that I had when I first started, is I was just continuously uploading things onto my portfolio, but I wasn't mapping anything until maybe 3 months or towards the end of my first job. I got an email from my supervisor saying, I can't see anything on your portfolio. And that's because I hadn't mapped anything. So map as you upload things. It saves you time, and also your supervisors or whoever's reviewing your portfolio can see how you're engaging with your portfolio as well. So the next point is find out how big your study budget is and attend courses that will help your career progression. So yeah, definitely. I believe in England, the majority of trusts have a form of budget available to foundation trainees. I'm not too sure what it is in Scotland. I don't think they do, but again, I would ask your trust, and yeah, make sure to use your study budget to explore, for example, other courses or other specialties or other skills that perhaps you wouldn't necessarily have access to in your current job at the time. And obviously, this is money which is available to support your training in your during your time as a foundation doctor. And obviously, as you leave foundation training, that you can't claim that money back. So it's only sensible that you make use of it during your training as a foundation trainee. So my next point is quality improvement projects. Yes, so you have to complete a quality improvement project. Well, I believe this year you have to show that there's been some sort of learning or e-learning. Of course, we encourage you to complete quality improvement projects. It's useful. I think most specialties require you to complete one. One of the ways that I used to do, for example, an audit is before I start my next job, I would go and visit the ward or try to speak to the trainees on the ward and ask them if they're involved in any audits at that time, if they've just completed a first cycle. I would then ask them, could I perhaps complete the second cycle? Obviously, it's obviously good practice to complete a full cycle of an audit, and not only do both you and the other individual have that on your CV, but you also have some form of guidance as well as you complete the second cycle, because if you think about it, the other person's the first cycle, and that's one way of speeding the process. So next point, taster days. Yeah. Taster days don't all have to be taken on the same week. I think that's also I believe that when you take taster days, you have to take a whole block. What I tend to do to try and make things easier for the rota coordinator and for the team as well is I used to break up my taster days. So for example, I do two taster days in 1 week, then another day the week after, and then perhaps another 2 days the week after. And obviously I would try and, negotiate this with the rota coordinator and also the clinician who's organising my taster days as well, to try and make things as easy as possible. Next slide. So yes, teaching is mandatory. One of the misconceptions is that if you're on call that you can't attend teaching. That isn't the case. What I recommend you do is you give your bleep to your registrar. Just tell them, hey, I'm going to mandatory teaching. It's going to be maybe an hour and a half. Could you hold my bleep? And 9 times out of 10, one would assume and hope that they would be happy to hold the bleep for you as you go to your teaching. So don't miss out on your teaching as well. Don't leave your portfolio until the end, because anything could happen during your time as a foundation trainee. You could fall sick, bereavement, other things. And if you're having this, or if you're thinking about this bare minimum policy, all I need is 3 mini KEXs or 3 CBDs, and then something happens, then obviously you can't achieve those 3 mini KEXs and CBDs, then you've gone below the minimum if your aim was the minimum. And obviously, you would find it hard to justify why you should progress. So always do more. And obviously it's for your learning as well. If you are experiencing a difficult time during your foundation training, I urge you to speak to your clinical supervisor or your educational supervisor as soon as possible. Don't delay it. It only exacerbates the problem, and you'll be surprised on what they can do to try and help support you during your training as well. And you have to forget about this whole macho bravado outlook that you have to sustain, or you have to bulldoze through all the problems and scenarios that you come across. I would speak to your supervisor sooner to try and help you with whichever difficulty you might encounter throughout your training. Next slide. So yeah, I understand this talk's all about passing ARCP, and trying to do well and trying to fill the criteria. But I think my most important take-home message is that you look after yourself during your foundation training. I'm sure you'll experience, as I did, many highs and lows, but equally, it's a natural phenomenon, and I would again urge you to approach and speak to anyone when you're going through a difficult time, because your health and well-being is the most important factor throughout your training. And I'll hand over back to Mike.
Great, thank you, Wassim. Excellent presentation there about looking at it from a trainee's point of view. So I hope those presentations by the panel have been helpful and have hopefully answered some of the questions. But we've got a number of questions that we can answer in the remaining time. First of all, a couple of outstanding questions that were asked before the webinar, before we get to the Slido ones. First of all, if a trainee is working less than full time, do the COVID ARCP guidelines still apply? For instance, if my final ARCP is not due until next year, will I be working towards the 2021 guidelines still? The answer to that is in all likelihood yes. We have requested to the GMC that our current altered derogated requirements continue. At the moment, that's until September 21, but we've requested to the GMC, who are a regulator and have the final say, that they will continue for the rest of the academic year up until July 2022. We're yet to hear an answer. I think my advice would be, and I would reiterate what Wassim has said, if you try and achieve the bare minimum, there is a chance you won't quite get there. If you aim to do much more than the bare minimum, you will get there. So I would, in the time left between now and your ARCP, whenever that is in the next academic year, try and do as much as you possibly can, and then you won't have any sweaty moments. But we will be publicising what will happen with the requirements as soon as we know from the GMC. So we'll go on to the Slido questions, because there was a question about QI, but Claire answered that in her presentation. So we're going to start off with some questions about shielding. We do appreciate that the last 12 months, and it is only just over 12 months since lockdown, isn't it, has been horrible for society. It's been horrible for doctors, no matter what level of seniority. And I would like to put on record on behalf of the UKFPO the huge gratitude that we have for all the work that foundation doctors have done during the COVID pandemic. You have truly been an inspiration to us in many of the things that you've done, and we're very, very grateful, and we do fully understand how awful it has been. Nonetheless, there is a requirement from our regulator, the GMC, which doesn't alter, which is that all trainees have to achieve all 20 foundation programme capabilities and show evidence thereof. There is no proportion of that you have to show. It has to be all 20. So a few questions about shielding, which Fiona is going to answer. So I'll read them out. What would be the outcome and advice for trainees who've been shielding for several months? And then another bit is, how much would remote clinic teaching, audit work, etc., contribute for Arcp for shielding trainees? So Fiona, do you want to pick up on that?
Yeah, thank you very much, Mike. Yes, as you said, it's been a challenging time for everyone, and there's been many people shielding, both trainees and also consultant grades as well, having to shield. The unfortunate thing about shielding is that you still have to meet, as Mike has said, the requirements still have to be met. If you are off shielding for several months, then unless you have been able to work from home and demonstrate the competencies, then it is very likely that you are going to have an extension to your training. That will be at the discretion of the ARCP panel and your trainers, because you still need to have 3 satisfactory clinical supervisors and educational supervisors reports. So the likelihood is that if you have been shielding, unless you have been able to work in a post which has allowed you to work from home, and it's very hard to work as a foundation doctor from home, then you are very likely to have to extend. And there are going to be many people who have those extensions, and this will be given to you as an extension 10.2, where you need an extension to your training, but it's not your fault. It's a no fault extension, and it recognises that it's just one of those unfortunate things. In terms of QI activity, audit, presentations, working that you're doing, all that is valuable. It is valuable stuff that you can link to your curriculum, but it cannot replace a satisfactory clinical supervisor's report which says that you have actually performed to the right standard in your post. So unfortunately, those people who've been shielding for a period of time will require extensions, but I can't give details on an actual amount because it's obviously very personal.
Yes, each ARCP panel will make a decision about how long any extension would be on an individual basis. It's absolutely on an individual basis. There's no blanket rules. That's really very important to stress. So it's something that you know no one is wanting to do, but we do have to ensure that everyone who passes through F1 to get full registration and F2 to get the completion of the foundation programme, that they are up to the standard, and that has been observed. There is a question about 10.1 that doesn't apply to foundation programme because all of our ARCPs are critical progression points. So F1 to get full registration and F2 to complete the foundation programme. So thanks, Fiona. Now some questions about some specifics about the ARCP, which I'm going to ask for Claire. So a simple one to start, Claire. Do trainees need to complete the career support form as part of the ARCP?
No, it's not. Oh, sorry. No, it's not a requirement for them to complete the careers support form, but I think it's one of those areas that's good for yourself to complete. So it allows you to really reflect on where you're going and whether you have had the right advice in terms of future career planning.
Great, thanks. Here's an interesting question. I found it difficult to know where to put some things on the portfolio, e.g. attending a junior doctors forum, L&C meetings and other meetings where you represent trainees. And I think this goes for a lot of sort of, if you like, extracurricular type of work. Claire or Wassim, well, Claire, any thoughts on where that would go in the e-portfolio, excuse me?
Yeah, I think the LNC and sort of trainee rep fits neatly into the leader form, actually, which isn't well used, but is there for people to use for exactly that sort of thing. If you don't want to use the leader form, there's an additional achievement section which you could put it in. And also, I think Wassim's emphasis on reflection is actually really important here. Having a good reflection about what you have achieved in the role may be more important than actually doing the role.
Thank you. And another one for showing ALS competence. If you did an ALS course in F1 and attached the certificate to your F1 e-portfolio, do you need it to attach it again in the F2 e-portfolio? Well, the answer to that is yes. It won't be a big problem, but yes. Is the short answer, but it will still apply if you've done ALS because that's valid for 4 years. Claire, a couple of questions about mini CXs and CPDs. Are there any restrictions to how many times the same person can sign off your SLEs, mini CX or CPDs, and can F2s sign off mini CXs?
So F2s can't sign off the SLEs. It has to be doctors more senior than F2, and also nursing staff who are band 5 at least. It's better practice to get a variety of people to sign off those SLEs. Basically, if you always have the same person observing you, it's likely that they're going to feed back about the same sort of things to try and develop yourself. In reality, what you want is a variety of people telling you ideas where you might be able to progress. The point of the SLE is not to sort of document an achievement, it's to identify areas where you might be able to develop your skills, knowledge, sort of general performance, such that you are a better practitioner going forward.
Thank you. And now a question that I'll ask Fiona to answer. Any advice for trainees in departments where consultants or registrars tell you SLEs are not their job and not their problem? The foundation programme director is aware, but there's been no improvements yet. If you heard of that as a foundation school director, Fiona, what would be your approach?
Well, that's an interesting question, isn't it? I think obviously it is their responsibility to sign off SLEs. As a foundation programme director or foundation school director, I would be going very much to that department and speaking to the lead in that department. I would actually also suggest that you complete the NTS survey and put that in the NTS survey, because it's very important that that information is captured. That the information that goes into these surveys is valuable. It's reviewed, the GMC capture that information, and it is acted upon. So I would say that it needs to be escalated to your foundation school director, who should be speaking to your service leads, your directors of medical education. But that is not acceptable. But please do fill in your NTS form, fill it in and make those comments. It has to happen.
I think the other thing that you could do if you're in England would be to, if you're in England, you could do an educational exception report based on that, which will then bring it to a wider view within your hospital trust. I would just tell as many people as you can about that, the foundation programme director, if you don't get any joy, the foundation school director, because as Fiona says, and I'm sure Claire would agree, that's totally unacceptable. There's no exceptions. It's totally unacceptable. Okay, one last question we've got here. Can F2 sign off core skills? Claire, would you like to answer that?
Yes, F2s can sign off the core procedures, so that is the sort of slight difference in terms of who can sign off what. Obviously, they should be competent in doing that skill in order to be able to sign it off.
Okay, and then here's another one. If you've completed all mini CXs and CBDs already, do you still need to do more?
You don't necessarily need to do more, but actually if you've completed them all in the first placement, it won't look very good to the Arcp panel if you've done nothing after that first placement. So I would suggest it's still worthwhile, because it's also an opportunity to get feedback about your performance. If you're not sort of interacting in a way of, are you able to give me feedback about my performance and document it, then it's sometimes challenging to get feedback, particularly in departments that we've heard about earlier.
Again, I would really reiterate what Wassim said, which is that if you aim for the bare minimum, if that's your aim, then there's reasonably high chance you won't get there. You don't need to slip up very much at all and you won't get there. If you aim for quite a long way above the bare minimum, you will then, if you slip up, you've still got plenty of slack. I think that's a really important message. People who aim for the bare minimum at most will achieve the bare minimum, at most. If you aim for more than that, then you'll be absolutely fine. And it doesn't matter then if somebody doesn't fill in an SLE form if you've already done more than you needed to do. Whereas if you aim to do 6, because that's the minimum, if somebody doesn't fill one in, you're then going to have a difficulty at Arcp. And I think that came really clearly through in Wassim's excellent talk. One last question: is there any limit on e-learning logged in as teaching with the revised requirements this year? No, because of the change to the derogations due to the COVID pandemic, and so e-learning counts because we realised it's been a very difficult environment. I'm going to draw the questions to a close there. Thank you to all of you who've gone the distance and who attended this webinar and are still with us. Thank you very much indeed. And I'd really like to thank all of the presenters, Clare van Hamel, Fiona Cameron, Wassim Merzougui, for giving up their time to try and help you to make sense of the Arcp process. And if you have any further questions or issues, then please contact your educational supervisor, your foundation program director, or your head of foundation school. We'd be really grateful if you could let us know if it was useful. We're looking at the possibility of doing more of these, and if you found it useful, please let us know, and keep checking our social media feeds for further updates and guidance. So I hope you enjoy the rest of the evening. Good luck for the rest of your foundation training, and I look forward to seeing you again in the future. Good night.